I'm in pursuit of good sight and healthy living for all.
Hello and welcome to In Pursuit of. I hope you have been watching regularly and have subscribed to the channel. Today's guest is Ms. Tanuja Joshi, Managing Director of Venu Eye Institute. Welcome, Tanuja.
Thank you so much. Thank you for inviting me.
Thank you so much for being here. So, Tanuja, tell me, how does Venu Eye Institute ensure accessibility and availability of good eye care for the underprivileged and underserved communities?
So, as an organization, we work at three levels. The first level, which is the tertiary teaching and referral hospital based in Delhi. It's an advanced eye care hospital which covers all the specialities. It's equipped with all the equipment. At the second level, which we call the secondary level, we have 4 rural hospitals in the states of Uttar Pradesh, Haryana, and Uttarakhand. And then we also have an extensive community outreach program where we organize OPD screening camps in rural areas and in the urban areas in the NCR of Delhi, around Delhi. And that's how we reach out to the underserved. We also, in the main hospital in Delhi, we also run a free OPD every day for people who cannot afford.
What impact has the Institute's outreach program had on, reducing blindness and related eye issues?
So till date, we have examined about 86 lakh patients, which is like almost 8.5 million, which is the population of Switzerland, or also the combined population of both Chennai and Calcutta.
My goodness.
We're very proud to say that 70% of all the patients that we have treated are from the poor or underprivileged background.
So how do you measure impact? Just so I may understand, like, what do you mean by success means what?
Success, one, means that the patients that we are treating, what is the post-operative results and what impact have we made in their quality of life.
Right.
The other also is that when we are going to these areas, over a period of time, we realize that the number of patients will decrease, the operable cases, because you have already catered to their needs. And then there'll only be the fresh add-ons. So backlog gets addressed,
right,
and then we move to other areas. And we've been expanding. Every year we take a stock of which are the areas where the surgeries are now coming down, and then we reach out to the newer areas.
So number of surgeries actually come down at a steady rate?
One of the ways of measuring is if you're going to the same community, the same geographical area, in the beginning you'll have the numbers will be higher because there's a backlog. And then there'll only be the add-on cases.
Right.
So then you realize that the number of surgeries have come down.
Okay.
And that is one of the indications that you'll know that the backlog is now being addressed.
Wow, very nice. And is this rate like pretty fast at some point?
It depends on the areas that you're going to and what kind of population is there. Is there more aged people living in that area? So like, for instance, there will be a difference between the urban slums and the rural areas, because in the urban slums, you have migratory population. Mm-hmm. So the elderly will be less.
Right.
But in the rural areas, there will be more elderly people that you'll come across.
Very interesting. So is there any success story that you've had, where you would say that, in the community itself, where you would say that, wow, this is why we do what we do?
So I'd like to share 2 stories, and they will show you the two ends of two spectrum. Mm. So we did this camp in Rajasthan, to be exact, in the district of Sawai Madhopur. Mm. And we didn't know, of course, when we operate on this lady who was in her 30s, which is unusual, that she actually saw her children aged about 10 and 8 for the first time in her life.
Goodness.
And the second was an urban story where we had a retired gentleman who was in his early 70s. And when we operated, normally, the thing is that the patient comes very happy that, oh, I can see, I can do my things again. But actually, the family was thanking us because they also had been relieved as caregivers. So they also became independent. So those are very interesting. And that's when you realize, what you're doing, this is the impact that you're making, not just to one person, not just to the patient, but to a whole family and sometimes the whole community.
Wow. Really the joy of sight.
Absolutely,
is something else.
Absolutely.
Amazing.
We take it for granted.
We do take it for granted. That's true. So how did COVID-19 impact your work, whether it was in the urban space or in the rural communities?
I think the impact was far more in the rural communities because of government guidelines. We had to shut down completely. But in the urban setup, we kept our services on. Of course, the number of patients fell. Fortunately, eye care is to a large extent elective.
Right.
So patients, people can postpone. But the other challenge was also that a lot of people were suddenly living alone with no help. So if they had cataract or diminished vision, it actually impacted. So that was a challenge, but we took all the precautions and reached out to those patients and helped. But the impact definitely came because the revenue fell and funding almost stopped because all the donations that were coming all stopped. So that was definitely a huge challenge. But fortunately also we keep our costs very low. So we were able to tide over that period.
Please share some, some strengths that are unique to Venu Eye Institute and some challenges also that are unique to Venu Eye Institute. What would those be?
I think our biggest strength is our people. When I look around, most of our staff has an average lifespan with us, has been with us for over 8 to 10 years, which is a bit unheard of these days. A large segment of them are also 20, 25 years with us.
Really?
And some of them, they come from a pretty long distance. And especially, in the OT and in the wards, and they have to be there at 6 in the morning. Come hail, come storm, winter, fog, they'll be there. And there are days when if it's they know there's going to be foggy or heavy rains, they won't go back home because they don't want to be late on the duty next day. And I wonder, and then they say that, it's the vision and the mission, the values that the organization stands for. The founder has laid a very strong foundation, and God's grace, it's still alive. And that's one of our biggest strengths. Challenge, I would say that, over a period of time, donations have come down. So whatever we earn from our paying patients, whatever we save, we use for giving free services because that is our main, goal, to reach out to the poor. So funding is a huge problem, and our challenge then comes in capital expenses. So that I would say is a unique challenge for us.
So amidst all these challenges, which direction is Venu Eye Institute heading into?
The foundation, which is eye care, will continue, which is what we stand on. But from, even in the eye care scenario, from the disease pattern, if we look, 60% has been cataract and 20% has been refractive error. Both are curable. You can't stop cataract from happening. Similarly, you can't stop refractive errors from happening, but there is a cure for it. But now with the longevity of life increasing and lifestyle diseases becoming a huge challenge for everyone, it's impacting the eye care.
Really?
Because one is that if we don't manage diabetes, for instance, post-op cataract results are affected. Also, diabetes affects, one of the first organs it affects is your eye. So diabetic retinopathy is becoming a huge challenge. It definitely has an impact on your retina, and that loss of sight we cannot restore back. So now we are also moving on to managing, and that's why I said, I'm in pursuit of also healthy living. So we are also now bringing in integrative medicine, where we have a geriatric specialist, we have a naturopath, because modern medicine and naturopathy both have to combine together to address the lifestyle disease challenges. Because one focuses a lot on the symptoms and the treatment, the other is working on the root cause.
Absolutely.
So we are bringing these two, and that I think is the add-on service that we're going to be now adding.
Lovely. Well, Tanuja, thank you so much. It's nice to know more about the institute and where it's heading, and I hope people kind of realize how their lifestyle can be fixed to accommodate better eyesight.
Thank you. It's
Thank you so much. Thank you for watching, and I will continue my conversation with Tanuja Joshi of Venu Eye Institute. Stay tuned.